Welcome to Official Philly Image. Hi, I'm Tahsheem Aladean. Today we'd like to inform you about periodontal disease, a disease that many people may or may not know about. In 2009, 26% of the U.S. population aged 20 and older suffered from destructive periodontal disease. Today I'm here with a well-known Philadelphia dentist that will give you information regarding this disease, what it does, and how to treat it. Dr. David Tecosky. Hello, doctor. How are you today?
I'm doing great, and how are you?
I'm fine. Thank you for having us.
It's my pleasure.
Okay, doctor, let's just get right into it. What exactly is periodontal disease in the first place?
Periodontal disease is a bacterial infection of the gums and the supporting tissue of the teeth in the mouth. The first form of it is gingivitis, which is an inflammation of the gums and the periodontal ligament which supports the teeth. When you have gum pockets that are greater than 5 millimeters and evidence of bone loss, you have periodontitis.
What type of person can get gum disease?
Anyone can get gum disease. Anyone who has teeth can get gum disease, from a child to a senior citizen.
Is periodontal disease communicable, and how is it spread?
It is communicable because it's caused by bacteria, and the bacteria can be transmitted from family member to family member or person to person through kissing. Basically, is the way you can do it.
Is there a connection between periodontal disease and other areas of the body?
Well, periodontal disease originally was detected as a bacterial disease, and recent research in the last several decades has shown that periodontal disease can affect both the mouth and other areas. We have found that periodontal disease bacteria and protein byproducts of the bacteria have been found in atherosclerotic plaque in the heart and in stroke victims.
Wow.
And we've noted also that periodontal disease and diabetes has a bilateral correlation.
What are some of the signs of periodontal disease?
Well, the patient will see the initial changes of bleeding gums, puffy, swollen gums, maybe a bad taste in their mouth. They will also note perhaps they have a little recession of their gums. If it's bad enough, they may even find that their teeth are loose when they chew or if they wiggle them with their fingers. Those are signs that a patient can readily see. But the diagnosis really depends on a dentist or a periodontist examining the teeth and looking for gum pockets with a periodontal probe and taking x-rays to complete the diagnosis to make sure whether there's bone loss or not, which would indicate whether you have gingivitis or periodontitis.
Is there a specific time that your teeth should be checked for gum disease?
Well, every time you go to the dentist to get your teeth checked, you should be checking for gum disease. Everyone should have their teeth checked every year. Everyone should be seen at least twice a year. Patients with a known history and treatment for periodontal disease should probably be on a more frequent schedule of periodontal maintenance. Sometimes that periodontal maintenance is completed by a periodontist, and sometimes it's completed by a general dentist. Sometimes it's shared by both those professionals. So this disease process should be maintained on a very frequent basis in terms of diagnosis and preventive maintenance once you know that you're susceptible to getting the disease.
Are there any connections between oral cancer, smoking, and smokeless tobacco?
Absolutely. Patients who use smokeless tobacco, patients who smoke cigarettes, cigars, pipes, have a much greater risk for oral cancer. Smokeless tobacco affects young boys to a high degree.
Really?
Because they chew tobacco or use smokeless tobacco snuff products or chew materials.
Because they think it's more healthy.
They think it's fun, it's safer to use, but they're at much greater risk for very disfiguring oral cancer surgery.
Wow.
So I would strongly recommend not using those products at all.
Is gum disease a risk factor for heart attack or heart problems?
Well, the current research is showing that the periodontal pathogens in gum disease, the bacteria and proteins in the bacteria are found in the coronary artery plaque, and there's increased levels of inflammation. We don't know yet causative factors, But the fact that there's such a high correlation is very disturbing.
How exactly is gum disease treated and who treats it?
Okay. Gum disease is treated initially by cleaning the tartar and the plaque off the surfaces of the teeth. And if the disease process is more serious, for example, if you have been determined to have periodontitis, have gum pockets with heavy tartar accumulation, then scaling and root planing is completed on the root surfaces to remove the tartar, smooth out the roots, and reduce the inflammation on the teeth. And that's very often done with local anesthesia, so that during the procedure there's no discomfort. Post-operatively or after the treatment, you go home. Sometimes there's soreness and there's sore roots. Sometimes the gums are sore afterwards. That's treatable with medication as well. If the gum pockets are not reduced by scaling and root planing, sometimes you have to have the soft tissue readjusted in terms of the shape of the anatomy, so that we can create a situation where you can clean your teeth and maintain them without food impaction and recollection of these pockets.
Many people are concerned about pain when they come to the dentist, and that's why so many people are discouraged that would allow this type of disease to occur in the first place. Is there any pain associated?
Well, we have some really great medications that we're using, both injectable and topical, that we can place on the tissue to disable the pain response. There's patients that can be put to sleep in certain situations if necessary. So there are ways to deal with the pain during the treatment. After the treatment, there are medications you can take to deal with the pain, but the pain is not as bad as the pain you would have if you lose your teeth and can't chew, you can't smile in public. So the pain of losing teeth and inability to talk and be presentable in public should be worse than the temporary discomfort from having your teeth worked on.
Can gum disease occur right after treatment again, and how soon should it, if at all?
That's an excellent question. Well, it can absolutely reoccur after treatment if you don't do preventive maintenance at home or do the follow-up care in the dental office, depending on your needs. It can recur as quickly as 2 to 3 months after getting your teeth cleaned, because that's how long it takes the bacterial populations to repopulate gum pockets, the ones that cause the invasive infections in the soft tissue and in the bone.
Okay. Last question. How soon can I make my appointment with you?
Today.
Okay, got it. Good job.
Okay.